15 most terrible diseases in all history. Number 15. Bubonic plague. The bubonic plague, or Black Death, struck Europe in the 14th century and became one of the deadliest pandemics in history, killing an estimated 200 million people. This devastating illness was caused by the bacterium Yersinia pestis, which spread through fleas living on rats that traveled along trade routes. Once bitten by an infected flea, humans experienced fever, intense pain, and swollen lymph nodes that turned black, giving the disease its dark name. Death often followed within days, and doctors of the time, lacking understanding and effective treatment methods, were helpless in the face of the disease's spread. The plague didn't just take lives, it upended society. Villages were emptied, and farmlands were left untended, leading to food shortages. With labor scarce, peasants gained new leverage, demanding better wages and working conditions, and weakening the feudal system. The church, seen as powerless against the plague. Number 14. Ebola. Ebola, a viral disease first identified in 1976, remains one of the most feared infections due to its high mortality rate, which can reach up to 90% in severe outbreaks. The virus causes fever, severe headache, muscle pain, and in later stages, internal and external bleeding. Transmission occurs through direct contact with bodily fluids of infected individuals or animals, particularly in regions where healthcare infrastructure is limited. Fruit bats are considered the natural hosts, often transmitting the virus to other animals that humans then come into contact with. The deadliest outbreak occurred in 2014 in West Africa, where more than 11,000 lives were lost, and the epidemic spread fear worldwide. This outbreak exposed gaps in the healthcare systems of affected countries, and the rapid spread highlighted the need for swift, coordinated global health responses. The international community mobilized resources, medical personnel, and research, ultimately leading to the development of experimental treatments and vaccines. Number 13. Spanish flu. The Spanish flu pandemic of 1918 to 1919 was an unprecedented global catastrophe, infecting nearly 1/3 of the world's population and causing between 20 to 50 million deaths. Despite its name, the virus likely originated in Asia, spreading worldwide during World War I as soldiers moved between countries. The Spanish flu hit its victims with severe respiratory symptoms, including fever, shortness of breath, and extreme fatigue, with many succumbing to secondary infections like pneumonia. The speed at which it spread and the lack of effective treatments made it a relentless killer. With limited medical understanding, crowded hospitals, and no vaccines, healthcare workers struggled to cope. Governments implemented quarantine measures, and people were advised to wear masks, marking one of the first instances of global pandemic response. Number 12. Poliomyelitis, a viral disease that mainly affects children, caused widespread fear throughout the 20th century. Characterized by fever, fatigue, and in severe cases, paralysis, polio was once one of the most feared childhood diseases, leading to high mortality and lifelong disability. As it primarily spreads through contaminated water or food, outbreaks surged in areas with poor sanitation. Families lived in fear, as the disease could paralyze or even kill. The development of effective vaccines by Jonas Salk in 1955 and later by Albert Sabin was a monumental turning point. These vaccines led to global vaccination campaigns, drastically reducing polio cases worldwide and bringing us close to eradicating it entirely. While a few regions still report cases due to challenges in vaccination access, the disease's near eradication stands as a significant victory in public health. Polio's history is a testament to the power of scientific innovation and the determination of global health initiatives. Number 11. Smallpox. Smallpox, caused by the variola virus, devastated communities worldwide for centuries with its high mortality rate and scarring effects on survivors. The disease spread through direct contact and presented symptoms like fever, severe body aches, and a distinctive rash that would leave deep scars. Smallpox outbreaks often led to widespread suffering and death, with entire populations vulnerable due to the virus's contagious nature. The turning point came in 1796 when Edward Jenner developed the first successful smallpox vaccine, marking the beginning of modern immunology. After centuries of suffering, the vaccine offered hope and led to a worldwide effort to eradicate the disease. This global campaign reached its goal in 1980, making smallpox the first human disease eradicated from the planet. Today, smallpox is remembered as a triumph of scientific discovery and international cooperation, leaving a powerful legacy in the field of infectious disease control. Number 10. Malaria. Malaria, caused by Plasmodium parasites transmitted through mosquito bites, has been a persistent threat to human health for thousands of years, especially in tropical regions. It causes high fevers, chills, and severe anemia, symptoms that can lead to death if untreated. Historically, malaria was responsible for widespread death and suffering, particularly in areas with dense mosquito populations. Malaria spread along trade routes and even influenced the outcomes of wars, reshaping entire civilizations. Modern efforts to control malaria focus on reducing mosquito populations with insecticides, providing anti-malarial drugs, and distributing insecticide-treated mosquito nets. Recent developments include malaria vaccines that are showing promise in reducing infection rates. However, malaria remains a significant health issue, particularly in sub-Saharan Africa, where it disproportionately affects children. The ongoing fight against malaria highlights the importance of international cooperation in combating diseases linked to environmental and socio-economic factors. Number 9. Leprosy. Leprosy, also known as Hansen's disease, has been a part of human history for thousands of years, causing skin lesions, nerve damage, and, if untreated, severe disfigurement. The disease carried a heavy social stigma, often resulting in the isolation of those affected in leper colonies. In these places, people with leprosy faced not only the physical challenges of the disease, but also the emotional pain of being separated from their communities. With the discovery of effective antibiotic treatments in the 20th century, leprosy became curable, though cases still occur in certain regions. Today, much of the stigma has faded, and people with leprosy can be treated and reintegrated into society. Despite the progress, leprosy serves as a reminder of the importance of compassion and public health efforts in eliminating diseases that affect the world's most vulnerable. Number 8. Rabies. Rabies is a viral infection that attacks the central nervous system and is almost always fatal once symptoms appear. Transmitted primarily through the bites of infected animals like dogs and bats, rabies induces symptoms such as anxiety, confusion, hallucinations, and intense muscle spasms. If left untreated before symptoms develop, the disease becomes fatal. Rabies' high fatality rate makes prevention critical, especially in high-risk areas. Fortunately, rabies can be prevented through immediate post-exposure vaccination, which is widely administered in areas where rabies is endemic. In many parts of the world, pre-exposure vaccination programs target populations with high exposure to rabid animals, such as veterinarians and wildlife workers. Despite its deadly nature, rabies prevention efforts are a testament to the importance of vaccination in combating zoonotic diseases and protecting public health. Number 7. Cholera. Cholera is an acute bacterial infection that causes severe diarrhea, dehydration, and can be deadly within hours if left untreated. Spread through contaminated water and food, cholera has been particularly deadly in regions with limited access to clean water and sanitation. Throughout history, cholera outbreaks have caused immense suffering, often in areas facing natural disasters or war. Efforts to combat cholera include the development of oral rehydration solutions, which drastically reduce the death toll, as well as improvements in sanitation and hygiene. Vaccines have also been developed, and in emergency settings, mass vaccination campaigns can help curb outbreaks. However, cholera remains a risk in many parts of the world, particularly in areas lacking basic water and healthcare infrastructure, underscoring the critical need for accessible clean water and effective public health measures. Number 6. HIV/AIDS. HIV/AIDS emerged as a global health crisis in the 1980s, profoundly impacting communities worldwide. HIV attacks the immune system, leaving the body vulnerable to infections and certain cancers. Initially, the stigma surrounding HIV/AIDS led to discrimination, delaying effective responses. However, through awareness campaigns and medical advancements, attitudes have shifted, and HIV/AIDS is now widely understood as a manageable condition with appropriate treatment. With antiretroviral therapy, people living with HIV can now lead long, healthy lives. Education on safe practices, access to testing and treatments have been crucial in controlling the virus's spread. Although challenges remain, particularly in areas with limited healthcare resources, HIV/AIDS stands as a testament to the power of community, advocacy, and medical advancement in overcoming once devastating diseases. Number 5. Tuberculosis (TB). Tuberculosis (TB) is an airborne bacterial infection primarily affecting the lungs and can be deadly without treatment. Known since ancient times, TB was rampant in crowded urban centers during the Industrial Revolution. Symptoms include persistent cough, fever, and weight loss, and the disease often proved fatal. TB's spread was fueled by poor living conditions, prompting the establishment of sanatoriums for infected individuals. The discovery of antibiotics in the 20th century made TB treatable, though drug-resistant strains pose an ongoing threat. In many parts of the world, particularly low-resource areas, TB remains a leading cause of death, and global efforts continue to eradicate it. The fight against TB underscores the need for ongoing vigilance, improved living conditions, and healthcare access. Number 4. Yellow fever. Yellow fever is a viral disease transmitted by mosquitoes that causes fever, chills, and jaundice. In severe cases, it can lead to liver failure and internal bleeding. The disease has caused deadly outbreaks, particularly among European colonizers in tropical regions, and devastated local populations in the Americas and Africa. Today, yellow fever is preventable through vaccination, with health regulations controlling its spread. However, outbreaks can still occur in areas where vaccination rates are low, especially in regions with favorable climates for mosquito breeding. Yellow fever's history reminds us of the importance of vaccines in preventing vector-borne diseases and the ongoing need for vigilance in controlling their spread. Number 3. Avian influenza, bird flu. Avian influenza, or bird flu, mainly affects birds, but has caused concern among humans due to the possibility of transmission from infected birds to humans. The H5N1 strain gained attention in 1997 due to its severe respiratory effects and high fatality rate. While human-to-human transmission remains limited, the potential for mutation has led to ongoing surveillance. The bird flu reminds us of the interconnectedness of human health with animal populations. Preventative measures and research continue to be essential in monitoring and responding to such zoonotic diseases. Number 2. Syphilis. Syphilis is a sexually transmitted infection that spread widely during the age of exploration, often leading to severe health issues if untreated. It can cause complications like neurological damage and organ failure in its later stages. With the development of antibiotics, syphilis became treatable, but rising infection rates in some areas show the importance of continued awareness. The history of syphilis highlights the role of healthcare education and accessible treatments. It serves as a reminder of the ongoing need for public health measures in combating infectious diseases. Number 1. Meningitis. Meningitis, an infection of the membranes surrounding the brain and spinal cord, can be bacterial, viral, or fungal, with bacterial meningitis being the most dangerous. Rapidly advancing, it can cause death or severe neurological damage within hours. Vaccines have been effective in reducing cases of bacterial meningitis, especially in sub-Saharan Africa's meningitis belt. Outbreaks of meningitis remind us of the importance of vaccination and rapid response in containing infectious diseases. Thank you for watching. If you enjoyed this video, please give it a thumbs up and don't forget to subscribe to our channel. Help us reach our goal of 1,000 subscribers by hitting that subscribe button and turning on the notification bell so you never miss out on our latest content. Your support means a lot to us.